the preparation for the polio vaccination that will take place from the 2nd of October to the 6th of October. It is important to note that the upcoming supplementary immunization activity aims to reach a culminative total of 3,843,275 children. And this includes the 2,021,663 children under the age of 10 years and 1.8 children under the age of 5 years in the 9 high-risk counties.
First and foremost, we are very happy that we have kicked off the countrywide training of the CHPs in terms of the registration of the Social Health Insurance Fund and Social Health Authority, and we are doing this across the country. We are targeting that the CHPs are going to cover the number of households that they have been assigned. Every CHP is assigned 100 households. Yeah. So we are expecting the CHPs to assist the members of the public, the ones who may be getting stuck during registration, and should there be a challenge, they will be referring them to the centers, the NHIF centers for assistance, and other centers that have been set aside for assistance. A CHP is an exposure of 100 households, and they are very critical because their work, they move from door to door. They are able to find people in their households, they are able to find people in their comfort zones, and they are able to explain to them, explain to them why it is important to register with Social Health Authority. And in the long run, explain the benefits as to why they need, each and every Kenyan must be registered for Social Health Authority. One thing that we must know is with NHIF, we used to have only 20% of the Kenyan population benefiting from the fund. However, right now we are targeting 100% of registration because nobody will be left behind. Even those people who cannot afford, they are going to be catered for by the government. They must be able to register so that the government will pay for them. And that is why our CHPs, in collaboration equally with the Ministry of Interior, the National Administration, the county governments, are going to be very critical to ensure we reach each and every Kenyan in every corner of this country.
Thank you. The Ministry of Health has alerted all high-risk counties to remain vigilant. And it is important with a particular focus on counties in Western Kenya due to the detection of type 2 polio in Bale District, Uganda, with Bungoma which borders Bungoma County. The detection of a positive case in Kamukunji sub-county further heightens the risk of polio transmission in Nairobi and its surroundings. And since the confirmation of this outbreak, several activities have been initiated. An alert has been issued to all the counties, and this is to enhance surveillance through active case searches. And Public Health Emergency Operations Center at both the national and county levels have been activated to coordinate preparedness and response efforts with technical committees operational at both levels to ensure comprehensive coordination. And the basic issue this week is registration to Social Health Insurance Fund, to Social Health Authority, registering with Social Health Authority for Social Health Insurance Fund, because this is the way to go. Should you not curb all these issues at the household, then you will need to visit a health facility for treatment. How do you get treated when you will not have your social health insurance card? It is important that this week we register and register in large numbers. The investigation team, again, have identified the suboptimal routine immunization coverage in both the host communities and among new arrivals in Kakuma refugee camp, with the majority of affected being the children aged 0 to 5 years. We are talking about Kakuma refugee camp, where probably most of these people are not Kenyans. Although the WHO Afro region was certified polio-free in 2020, Kenya has confirmed another 5 cases. And the country is currently responding to this outbreak of circulating vaccine-derived poliovirus type 2, which was detected in 4 children living in Kakuma refugee. We are not an island. We are a country that lives with other people, and especially even with our neighbors. And some of these diseases might keep recurring. We might keep seeing emerging and re-emerging issues, and especially because of the influx of human, because of trade, because of visitation, the influx in our country. We will keep moving in and out. Maybe some of the people or some of these children did not receive vaccination at the right time and the right dose at the right time. Kenya, insurance cover was taking only 20% of our cells. It is the high time we roll it out to 100%. And this is possible, up to and including Linda Mama, where our mothers will be delivering for free, ensuring that they receive antenatal care and postnatal care, and Edu Afya, where our children will be safe in school. The Ministry of Health, in collaboration with many other people, the partners, county governments, we have already conducted an in-depth case investigation, and the findings revealed a highly sensitive surveillance system for acute flaccid paralysis capable of detecting cases early. Detection at an early stage, because this is preventable, but at the same time, it's curable. We can be able to nip it at the early stages just to ensure we do not get more people who are paralyzed.